guys, welcome back to the Friday Q&A. So, it's summertime and I'm getting a lot of questions about sunburns, and many of you have asked that I do a Q&A all about what to do after you get a sunburn. I've done previous Q&As on sunscreen and sun protection and the need for sunscreen. So if you missed those, be sure and check them out. I'll be sure and list them down below. But today I'm going to be answering all of your questions about what to do after a sunburn, how to take care of it, and if there's anything to do to make the discomfort go away a little bit faster. So if you're new here, welcome. My name is Andrea. I'm a dermatologist. I film day in the life of a dermatologist vlogs, as well as sit-down skincare related videos, skincare routines, and a weekly skincare Q&A focused on a skincare topic of high interest on the channel. So if this sounds of interest to you, stick around and check it out. All right. Sunburns happen when we accidentally neglect to adequately protect our skin from ultraviolet light with both broad spectrum sunscreen use and physical protection with clothing and seeking shade, umbrellas, hats, all of these things that are difficult to keep up with when we're outside having fun in the sun. So sunburn occurs as a result of damage to the DNA of the skin cells in your skin, and it essentially signals that the cells have been damaged and are dying, and the redness that you perceive is the result of blood vessels and inflammation coming in to remove those dead, damaged skin cells. And what many people don't appreciate is that even light pinkness or light redness of the skin after sun exposure is in fact a sunburn, even though it may not be as painful as extreme sunburns that you may have had after a long day at the beach. That in fact is also a sunburn, even though it's not as, quote, as bad, and still is a signal that you have killed cells in your skin, and now your body needs to heal the top layer of your skin. But I wanted to give you that little bit of background before getting into it so that you have that in mind in terms of the approach of how to manage some of the symptoms. So my first tip for sunburn is, if you're outdoors, as soon as you happen to notice that your skin is becoming light pink, or you suspect you may be getting, quote, too much sun or are getting a burn, get out of the sun immediately. And the reason for this is that sunburn actually peaks about a day to a few days after sun exposure. So if you're already perceiving excessive sun damage and excessive sun exposure in the skin with either a little bit of light pink or just a cognitive awareness that you've been out too long, you definitely need to get in, preferably indoors, into a cool environment. Many of you ask me, as soon as I know that I've gotten too much sun or a little bit of a sunburn, what's the very best thing I should do immediately? Well, after removing yourself from sun exposure, it's helpful to put cool compresses on the skin and perhaps take a cool bath soak. Because as I mentioned in the beginning of this video, the redness that you perceive is the result of blood vessels getting dilated in the skin. And so to compensate for this, cooling the skin can help kind of alleviate some of the discomfort associated with the swollen blood vessels and redness. So just plain cool water, either applied with a damp washcloth or in a bathtub soak, can be very, very soothing on the skin. Furthermore, as the skin is damaged from a sunburn, the barrier is significantly impaired, and as a result, your actual skin, the actual organ of your skin, starts losing water very, very quickly and becomes dehydrated. And so soothing the skin with a little bit of water can be nice, followed by a moisturizer to the body that contains no fragrance or harmful irritants. This can also be very, very soothing. I frequently get questions about aloe vera, and is that good for a sunburn? Absolutely. So the secretions of the aloe vera plant and the leaves, which you may be familiar with if you have one of these plants, contain a variety of plant-derived anti-inflammatory compounds. And aloe vera consistently has been shown to be well tolerated with a low risk of irritation, and actually helping the skin of a sunburn and some of the redness associated with a sunburn. So absolutely, a plain aloe vera can be nice applied to a fresh sunburn and in the days following a sunburn. And a little pro tip, if you happen to have aloe vera gel or an aloe vera plant, it's nice to make yourself some aloe vera ice cubes with a plastic ice cube tray, and then apply the aloe vera onto the damaged skin as an ice cube, aloe vera ice cube. It can be so soothing and so alleviating as you're dealing with this. So that's a little tip. Now, many of you have noticed from my videos that I'm trying out a lot of fun new Korean skincare and Asian skincare, and aloe vera is an ingredient in a lot of these products as well. And so there's been many questions about use of these products on sunburned skin for soothing, and are those helpful? So I will caution you this, as I mentioned, when skin has been sunburned, the barrier is very much impaired. And so as a result, you're at an increased risk for irritation from cosmetics applied to the skin. So I will use this product that I've been testing out, the Holika Soothing Aloe 99% Soothing Gel that the folks at Beauty Sesh so generously sent to me to try out. This product is a lot of fun as a body moisturizer, but I would caution you against using it on a sunburn because it has a lot of fragrance in it that can be irritating and cause further blood vessel dilation and worsening of the sunburn symptoms. So while this is nice kind of as a body fragrance when things are fine, I would caution you against applying this product or similar products containing high levels of fragrance to sunburned skin, for the reason that I mentioned, that the skin barrier is so impaired that you're going to be very sensitive to fragrance. Even if you're somebody who tolerates fragrance well, this is a setup for potentially developing a fragrance allergy when you put such high amount of fragrance on an impaired skin barrier. So I would caution you to be very careful and look at the ingredient lists of anything that you're putting on the skin. Just because it says aloe on the front, make sure you flip it over and read all of the other ingredients and look for things like fragrance, which can be very irritating and a setup for a development of an allergy down the road that will further cause skin problems. So aloe, the plant, is fine, does not have fragrance in it, and is very helpful, but aloe in these kind of cosmetic things, I would say hold off on it until you are all healed from that. But this product is kind of fun, so but not to a sunburn is the take-home point there. As far as and so I get many questions about, well, what kind of moisturizing cream can I use to a sunburn that would be safe to use? And one that I am particularly fond of is CeraVe, which I talked about in my CeraVe review. I love this product. It has ceramides in it, which are an ingredient in the skin barrier, and applied exogenously to the surface of the skin can stimulate the skin to start to make some of its own. So that can be helpful to healing skin, to have a nice moisturizing, hydrating barrier cream going on there that has a little bit of ceramides. It can be very soothing. Again, keep this in the refrigerator. It's quite nice. This particular product is free of fragrance, which is fantastic. And you may find that you tolerate this well on your face as well. CeraVe does make a PM cream that also could be very helpful if you had a sunburn on the face that is a little easier to tolerate on the face. That cream contains an ingredient in it which I frequently get asked about It contains niacinamide. Okay, this product does not contain niacinamide, but the PM face cream does. Niacinamide is an ingredient that has been shown to reduce redness. So theoretically, it could be helpful in mitigating some of the damage and redness associated with a sunburn. However, some people find that applying niacinamide to the surface of the skin stings a little bit. So if that's you, back off on that and just go for a plain, fragrance-free, no-nonsense, basic moisturizer. I will list some down below, some for the face, some for the body as well. Now, many of you found me by virtue of my different tips video, and I get a lot of questions about, from those of you who are on different or on a prescription retinoid. I get a lot of questions about you continuing to use those after a long day at the beach, and I would advise you not to use those around the time that you're going outside. And if you've got a sunburn, you certainly are not going to want to put these directly onto a sunburn, okay? Because the skin barrier is healing itself, and it's probably a good idea to take a break from any harsh acids on the skin or different. Make sure you check in with your healthcare provider and follow up with them about when is most appropriate to begin using those products again. However, if you do suffer from acne, be aware that when you have a sunburn, your acne can actually get quite worse because a sunburn is highly inflammatory, and acne is by virtue an inflammatory skin disease. And so the addended inflammation as a result of the annihilation of your epidermis from excessive ultraviolet light exposure is subsequently likely to worsen your acne. So don't be terrified that stopping your acne products has caused it. It's a result of too much sun. And the long story short is you need to let your skin barrier heal and things go back to normal, and you need to stay out of the sun and protect your skin and allow it to heal, and then you can move onward and upward. The next question that I get is, there are a variety of over-the-counter topical pain medications. Are those good to use on a sunburn? And I would say no. The reason being, as I mentioned before, that when the skin barrier is so impaired from excessive sun exposure, again, you are a very, very high risk of developing allergies to common ingredients and things. And one that is significantly reported is allergies to topical anesthetics, especially benzocaine, which is found in a lot of over-the-counter topical pain relieving creams. And there have been many reports of people developing a bad allergic reaction to this after applying it to a sunburn. So definitely want to avoid those to a sunburn, although it is tempting because the sunburn can be quite painful. One thing that you can do is consider taking aspirin or ibuprofen, over-the-counter anti-inflammatories. Of course, be sure and discuss this with your healthcare provider. Make sure these over-the-counter pain relievers don't interact with any medication that you're on, or there's a contraindication for you to take those. And if not, it is reasonable to try, and that has been shown to be very, very helpful in both reducing the pain associated with a sunburn, as well as improving some of the inflammation associated with a sunburn. Many people ask me about the need for drinking extra water when the skin is sunburned. The barrier of the skin is impaired, and you are in fact losing a lot of water from the skin even if you can't detect it. So it is prudent to stay extra hydrated and make sure that you aren't behind on your water consumption for the day, that you're well hydrated and taking good care of yourself. That will allow your skin to have all of the energy and nutrients that it needs to start to heal itself. I get a lot of questions about sunburns that have blisters on them, and what should you do when the sunburn blisters. It means you've gone actually a little bit deeper into the skin, and it's now separating to create that bubble. You should not pop the blister, as blisters form a natural band-aid on the surface of the skin that will allow it to heal. Keeping the blister intact protects you from an infection, as open skin allows bacteria to enter more readily and be problematic in causing skin infections. Now, on the flip side of that is if you go to a healthcare provider, they may pop the blister for you using a sterile instrument, and then they will dress the popped blister accordingly. But they should be the ones that do that, not you, so as to minimize your risk of infection developing in the healing sunburn site. And then I think one of the things that's most important to bear in mind and to realize is that after you've sustained a sunburn, it's important to actually avoid the sun for a period of time until the skin has completely healed. In the setting of a sunburn, your skin's immune system is lowered, you're at higher risk for developing skin infections, and further sun exposure is only going to exacerbate those risks and delay healing of the burn. Extra sun exposure also on healing skin puts you at risk for post-inflammatory hyperpigmentation or darkening of the skin as it's healing from the sunburn. So do stay out of the sun, do continue to wear sunscreens, and do continue your sun protective measures like wearing a broad-brimmed hat, long sleeve shirt, and that sort of thing. So although a sunburn may seem like a transient thing, sunburn is actually, as I said, the result of skin receiving too much sun. And even after the sunburn is healed, even after the sunburn heals, there are long-lasting damages within the skin. And this damage lays the groundwork for an increased risk of skin cancer. Therefore, it is critical to protect your skin from excessive sun exposure. Even a light pink burn is too much. I happen to be a fan of sun protective clothing as well as an additional measure. Tight weave fabrics are equally efficacious. You don't need a coolie bar cardigan such as I have. If you're new here, this is a cardigan with Universal Protective Factor 50 fabric, so it offers it offers the equivalent of SPF 50. And so it's nice as an adjuvant to sunscreen in that, I don't have to worry necessarily about my shoulders and forearms getting burned throughout the day or excessive sun exposure. But as I said, a tight weaved long sleeve shirt can be equally efficacious. So don't forget those things. All right, guys, so I hope you all enjoyed the Q&A this week, and I really hope none of you are at home suffering with a sunburn, but if you are, I hope this video was helpful. Give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye.